Hello, ladies and gentlemen. My name is Alaa Ousta. I'm a postdoc research fellow here at the University of Chicago's Emergency Medicine Department. And I'm here to talk about our study that focuses on the neurological outcomes, inflammation, and the blood-brain barrier in a murine model of cardiac arrest. As a disclosure, I'm a T32 trainee at the University of Chicago's Cardiovascular Sciences training program, and I have no commercial conflicts of interest. So when a patient presents with cardiac arrest, he or she passes through multiple stages, ranging from cardiac arrest to resuscitation, and, if successful, to a return of systemic circulation or ROS. And each of these stages presents a phase. The phase describes the state of blood flow throughout the organism. In other words, we're talking about the no flow, the low flow, and the reperfusion phases. And all of these phases contribute to what we call the post-cardiac arrest syndrome. This syndrome is a combination of three major pathological mechanisms taking place, and our study focuses on brain injury. With an increase in recognition in neuroinflammation and blood-brain barrier injury in various pathological mechanisms as TBI, we hypothesized that the severe neurological deficits perceived among cardiac arrest survivors are associated with neuroinflammation and an increase in blood-brain barrier permeability. To test this hypothesis, we came up with this model. So we induced asystolic cardiac arrest in mice by injecting them with potassium. And then following our CPR protocol, we either sacrificed the mice at 2 hours after intervention for a blood-brain barrier experiment, or we monitored their behavior using 3 major neurological assessments, and then sacrificed them at 72 hours for immunohistochemical analyses. So the first neurological assessment is the neurological function score that tests for 6 major elements, each scored from 0 to 2, giving a total score of 12. As presented here, along with the low survival rates presented in panel A, panel B showed a significant difference in the mean scores between sham and cardiac arrest mice. Sham mice are mice that undergo the same procedure without inducing cardiac arrest. And this analysis was studied using the mixed model analysis in order to account for time. So the next neurological assessment is the tape test. We take a 5mm by 5mm tape and place it on one of the paws of the mouse. We then time the mouse until it attempts removal of the tape, and this is the sensory component. We also timed it until it successfully removes the tape, and this is the motor component. The cardiac arrest mice, needed more time to feel the tape, but they also needed much more time to successfully remove the tape. And this shows that the motor deficits were much more pronounced compared to the sensory deficit. The third neurological assessment is the video tracking analysis, where we have a video tracking software used in our lab to test for locomotion. So visually, you can see that there's a significant difference in the map tracks between both groups. Translating those to numbers, we saw that there's a significant decrease in the total distance traveled by the cardiac arrest mice, as well as the average speed needed to travel this distance. The first histological experiment is the blood-brain barrier experiment. We sacrificed the mice at 2 hours after intervention, and after injecting them with a sodium fluorescein tracer. We then homogenized their brains and tested for fluorescence. The higher the fluorescence, the higher the blood-brain barrier permeability. Here, we saw that the cardiac arrest brains had a much higher blood-brain barrier permeability compared to control brains. And this is by testing for the fluorescence. So sometimes you love working in the lab so much that you would stay till midnight trying to stain the brains and get the results needed. After long hours of hard work, we saw that there was an increase in neurodegeneration in cardiac arrest brains compared to control brains using fluorogate-C staining. We also stained the brains with an IBA1 immunofluorescence stain. So IBA1 is a molecule that's found on microglia or macrophage-like immune cells that reside in the brain. And the higher the IBA1 fluorescence, the higher the microglial activity, and hence the higher the neuroinflammatory activity. Cardiac arrest brains presented with a much higher neuroinflammatory activity compared to control brains. As a conclusion, we were able to reconfirm global neurological injury after cardiac arrest, but we were also able to show that the motor deficits were much more prominent compared to the sensory deficits. And we were also able to associate neurodegeneration with neuroinflammation and blood-brain barrier injury. In the future, we would like to explain these mechanisms and see how do they contribute to this type of injury after cardiac arrest. We would also like to come up with a more targeted intervention comparable to hypothermia that would alleviate the neurological deficits perceived among the cardiac arrest survivors. And finally, I'd like to thank my team, especially Dr. Sharp, my mentor, and Dr. Garcia. And for any questions, please feel free to contact me using the contact information here presented in the slide. Thank you.